Hello, and welcome to the Seniors Network. We today will probably make an attempt to share information, also try to educate people on an epidemic that's kind of sweeping through our communities and neighborhoods and across the world. And that's something called HIV/AIDS. You know, AIDS came along a long time ago, and it's been around so long, we've kind of taken it for granted, kind of swept it under the carpet. But our community is still bereft with the disease and the epidemic. And so today, we want to talk about information that can heighten your awareness, that can get you back in tune to things you should be doing and become aware of so you can better treat the epidemic and be safe. I'm Steve Braxton, and I'm the founder and president of Marketplace Ministries, and I'm also presiding bishop with the Light of Illinois Diocese, and we have an affiliation with the Church of God in Christ International. And we have a panel of guests today. So with me today, a group of fine young ladies and one young man that's going to share with you and try to increase your awareness about AIDS. I want to welcome Sandra Miller.
Thank you.
Hello, Sandra. How are you?
Fine, thank you.
Good to have you. And you are with the Lawndale Community Health Center.
That's correct.
And you are the program manager for the HIV program.
That's
So
correct.
good to have you, and I'm looking forward to sharing some great information with you.
Thank you.
I have my sidekick with me, Mitchell Shola,
Pleasure.
Minister Mitchell Shola,
Yes, sir.
who is part of the Open Door Church.
Yes.
Give Pastor Nelson a little shout out.
Thank you.
And also, Mitch is the founder of City Harvest, which is an outreach ministry.
Yes.
And it just happened to be in a collaborative with my ministry,
Yes.
Marketplace Ministry. And we're very concerned about things in the community that affect people, and AIDS happen to be on top of that list. Also with us, we have Iman Little. Hello, Iman.
Hello,
Glad to have you with us.
glad to be here.
And you're with that big agency on the south side of Chicago, the one that has the distinction of having 9 Nobel Peace Prize winners from the University of Chicago. President of the United States was a professor at the university, the Law University, and Michelle ran their nonprofit. So you come from good stock. You're in good company. And you're part of the program at University of Chicago working with the AIDS program. So welcome.
Thank you.
We're looking forward to having more information shared from you with us. I was doing some research last night, and you guys are professionals in this, and I'm just going to do like a little skimpy piece of some of the research that I looked at last night. One of them said that AIDS has spread to the whole world, and that 85% are transmitted by heterosexual intercourse, and the other half is intravenous drugs. It also said there are 35 million people have died from the disease since the beginning of AIDS, and approximately 1 million people in America has been affected. And that's a lot more, but we'll stop there. Sonia, I want to start with you and the situation in the program that you're running with in Lawndale. But first I want you to tell us a little bit of something about what you do in Lawndale, and then kind of speak to that impact in the world and also what happens in Chicago.
Okay. Well, I'm the HIV/AIDS and Substance Abuse Program Manager at Lawndale Christian Health Center, located on the west side of Chicago in the North Lawndale area. Part of my program provides primary care services to those infected with HIV. The other part of our program also provides supportive services to those patients living with HIV. And I'd just like to make a point of reference right here, just to stick
Go
a
right
little
ahead,
pin
go
in
ahead.
there. When we're using different words, especially when we're talking about HIV or AIDS, it is preferably to say HIV, because HIV is the virus that would
Okay.
cause AIDS.
Okay.
And so we have more people living now with the HIV virus
Okay.
than we'd ever have living with the AIDS virus.
Okay.
The AIDS disease. Sorry.
Appreciate that little note.
So I like
editorial note. But
so
we are here to
right,
educate,
absolutely, absolutely. So that's just one point of reference
Okay.
right there. Primarily, I came from the south side of Chicago, working in HIV prevention and other local agency located on the west side of Chicago, working with youth and working with also adults and other adolescents, working with certain particular populations like sex workers, drug users, and providing HIV prevention around with that particular population and making sure that they are protected. At Lawndale is a little bit more intense because it involves the actual primary care services, the medical services that we provide there for our HIV patients. And so it is an intense type of program. We do have a high success rate in treating our HIV patients. And our supportive services are excellent because not only with the population, you must deal also with other factors such as homelessness. And so trying to provide services and get those persons or those people living with HIV who are homeless into a safe type of environment so that they could be able to be adherent not only to their medical care, but also with their medication, which provides healthy living for
You
them.
me jump in a little bit. You mentioned homelessness, and I know that's pretty prevalent throughout our communities and our neighborhoods. What specifically have you done to maybe attract or to get the homeless people involved and also to get them tested?
As far as testing for HIV, we do collaborate with certain homeless shelters.
Okay.
We do street outreach, meaning that we're on the corners of North Lawndale, South Lawndale, and Garfield,
Okay.
Austin areas doing outreach and street outreach and doing testing. We're in the parks. Basically, we're all over. We also collaborate with other agencies to come in to do testing also
Okay. All right.
with their population.
Thank you so much. Aman? Iman.
Yeah.
Right. Thank you. Give us a little bit about what you do at the University of Chicago, and also tell us how you penetrate and impact into the AIDS community.
Okay. Well, as opposed to Ms. Millard, we're on the research side, so we're not necessarily into services, but we're more so into looking at social structures within the communities that are at the highest risk for HIV. So the projects that I'm heading up are more so along the lines of trying to find those high-risk people who are not infected and trying to get them into preventative services that will keep them from getting infected. So, for example, the project that I'm working on currently is entitled PS PrEP, and we're trying to get high-risk clients who have been in a sexual relationship with someone who is HIV infected but have not contracted the disease, and to try and get them onto the PrEP pill, which is the new innovative prevention strategy. It's a pill that you take once a day to lower the chances of transmission. So we're going to try and follow those individuals throughout the year to see where their beliefs start and attitudes and their perception of risk are, and see how they change over time once they've been introduced to PrEP and possibly been prescribed for PrEP.
You are a young adult on the panel. You're younger than all of us. So how do you impact the younger people? Because, you know, they have this promiscuous attitude about the things they do in the streets, and they feel vulnerable and arrogant about different things. What kind of special approach do you use to get to them?
Well, first off, I think that's an issue, is that more seasoned adults believe that people my age are very promiscuous and we don't care and we feel like we're invincible, when we really just need someone to meet us where we are,
Okay.
as opposed to passing off these judgments. So that's one way that we get into the community. We've developed relationships with especially the south side of Chicago, which is where University of Chicago is based, and that's where a lot of our clientele comes from. So we have various projects going on. So they're in different projects, so they get to know our staff, and so they build that trust with us that helps us to penetrate. And also we do a lot of community-based events that bring them out to for them to mingle together and to mingle with our staff, so that that relationship and that trust is there before we even go in trying to do research projects on them. So it's really a community based instead of community placed, where we're just there to steal your resources and then leave and never do anything about it. So.
Okay. And Mitch and I talk a lot because we do a lot of things together. Mitch, I want you to speak to the concerns of the interests and the steps we're taking to build our collaboratives, and really why did we settle on talking about HIV today and have these two young ladies come on board to talk with us.
Thank you, Bishop. Like Ms. Miller said, you find when we go out into the different communities and we talk with the different agencies from time to time, we talk with case managers, and we come across families.
Right.
And it was so that when I started talking to a lot of case managers, I started seeing a lot of young men displaced from their home because of their sexual preference.
Right.
Because they were the problem with HIV, they were dealing with HIV, you know, because of their lifestyle. And after that, I started finding that a lot of them didn't know what to do next. You know, it really bothered and disturbed me when I started finding some young men that I had met maybe a year before had committed suicide. And part of it because they had been displaced from their home and they wasn't accepted. And it was a challenge for them to try to fit in. And so I started reading about the problem, and Ms. Miller was kind enough to sit with me one day in her office and give me some understanding on the challenges that take place in Lawndale and their challenge. And again, I'm meeting with case managers and I'm going out. So for me, it's a campaign that's necessary because I had did some reading where Yale Medical School said by the year 2017 that 50% of the HIV and AIDS population would be seniors,
Right.
who would be struggling with HIV. And so I'm looking at young men who, if they, like with Miss Little, get into her program and do the PrEP, they'll live long enough, but they'll be some of the ones that start having problems if they do or don't take care of themselves. So I'm gonna start thinking prevention. And for me, it's getting out there and trying to find out what agencies are doing what and where we can come along and saddle up and collaborate and bring more awareness to this problem, because now the high risk seem to be seniors as well as teenagers.
Right.
And in addition to the voices that crying out, I feel like now I need to add my voice and what we do to that.
Absolutely, absolutely. And of course, we are very concerned about the whole community,
Absolutely.
and we're concerned about what kind of services and program we can bring in terms
Absolutely.
of awareness,
Absolutely.
and then propel them to take action. And more than anything is about lifestyle change and the things you do and the things you put in your body. Ms. Miller, what about seniors and in particularly women when it comes to HIV?
Okay. When you look at seniors, basically, and the reason why they say that there's escalating rate of seniors becoming infected with HIV, primarily it could be caused by their partners. It is said in the HIV world that usually your seniors would have risky behavior, among the males, basically soliciting services outside of their company.
Right.
not knowing that they risk the chance of getting infected with HIV or any other STI. And so when you're talking about our women that are seniors, then they're not as aware of what's going on. And then once their partners come back to them, that the cause of HIV or them getting infected heightens in that particular way.
Okay.
So when we look at our younger people, we know that the HIV is at risk. But going back to seniors and HIV, with HIV, we also have, since HIV is not a death sentence anymore, so we have people that are living with HIV much longer. And I think this is a test to what Minister Schuller was talking about regarding the aging in that way. And so we have to make sure that we pay attention to that. What is basically saying we're doing an excellent job in taking care of our HIV people living with
Right.
HIV.
Right.
Yeah. But when we jump on the other end, when we're talking about youth, especially between the ages of 13 and 24, their risks are even more heightened. CDC in November 2014 put out or 2013 put out a fact sheet regarding youth that every 1 in 4 youth will have an HIV diagnosis. And that's a serious, that's serious data,
Yes.
basically.
Right.
And so what do we do with that information? Those of us that works in the organization to provide these different type of services and also collaborate with, ability to collaborate with other agencies and faith-based agencies or organizations within the communities in order to get that message out. And so we're specifically talking about prevention
Right.
because it works.
Right.
Yeah.
Iman, what do you find is the biggest challenge for young adults and children and them interacting and being open to and receptive to the education and treatment for HIV?
Well, I feel as though HIV is not always the highest on the totem pole, especially for the young adults, especially who are in low socioeconomic statuses. So you have their health is not always at the top. So you have poor schools, you have lack of access to health care, you have low unemployment, high police presence, high incarceration. So I feel like with that, young adults and adolescents and pre-adolescents and all that, they have so much to worry about that it seems like health is at the bottom of the totem pole. For example, if you take North Lawndale, for example, that is one of the poorest communities within Chicago. So you have a very poor community that has low socioeconomic status, that has underperforming schools, that has a lack of access to health care, and you have a high police presence, and then there's also a high incarceration rate. So you're asking them to juggle all of these things, including their health, and that seems to me to be sometimes the lowest thing on the totem pole. So getting them to care about their health when they have to worry about going to jail, when they have to worry about getting out of the cycle of poverty that they're in, when they're with family members and sometimes they're with grandparents who don't necessarily know and who they can't talk to. So I feel like all of those factors outweigh me necessarily going to get my health care or get HIV tests done or anything like that.
Thank you. Mitch, we were driving over this morning, and we always in mode talking about stuff in the community, and we were talking about some of the attitudes of maybe people in the streets or just general people, maybe unchurched people, about their arrogance, about their suicide tactics, and share some of that on the show. We were talking about, and some people have this cavalier arrogance, feel that they're not vulnerable. That they're invincible. That
They
kind
do.
of stuff.
They take some of the young men. They seem to take the cavalier attitude that this HIV is not going to be a part of their life. It's like they're immune. They don't feel like it'll happen to them,
Right.
and they get careless.
Right.
A couple young men. I had never heard of the term roulette sex,
Right.
you know, or raw sex.
Right.
And these are gay homosexual men who lifestyle where they just have sex. One side of the room could be HIV positive. The other side of the guest could be HIV negative. And they don't go in talking about protection. Not talking about the pill prevention that Ms. Little was talking about or the condom use. They just go at it and laugh and talk about the experience.
Mm.
And that I'm surprised by that, because you would think it's true, like Ms. Miller said, longevity now, people are living longer because of the treatment that they're getting. But they don't seem to care. They just live in the moment, you know. And it's that moment that I'm afraid is going to not only affect their lives, but they're going to affect the innocent lives of other people when they do change from partner to partner, you know, or from party to party. And so I'm concerned because it may be my daughter, my grandson, my niece, my neighbor's child. They get infected because of their neglect,
Exactly.
you know.
So, Ms. Miller, in Lawndale, you know, we have several locations, and I say we. I'm also part of the Lawndale community, and you work in Lawndale. I don't know if you live there or not, but you don't have to tell me that. But
I used to.
You live there too. Okay,
Yeah.
great.
I grew up there.
Okay, what do you find is a good entry point to maybe kind to eradicate, alleviate, or diminish some of that kind of attitude Mitch just talked about among people?
That's a very good question. And those of us that works in this field of HIV and in the prevention area, we're still trying to come up with different interventions in order to address this
Right.
particular problem.
Right.
Again, it's a attitude or behavior problem. So what do we do with that
Right.
alone? We have behavioral health, our psychologists and sociologists that works in there, and basically when we have maybe students that have that type of thought, usually we bring in a specialist in order to talk with them about that. Again, they are feeling that they're, you know, invincible. And years ago, working on the prevention side, I worked with the youth, and one of the attitudes was that, well, hey, if I get it, all I got to do is take a pill. That is not the answer. So the question is how do we bring them back, or how do we educate them
Right.
on the seriousness of getting infected with
Exactly.
HIV or
Exactly.
any other STI?
Exactly.
And it starts with education and prevention. How do we do that? We have to do that as a community. We have to do that as collaborative partnerships with other organizations, and especially with our faith-based institutions.
Absolutely.
Without that, then it's not. And so we just all have to just work hard together to collaborate and making sure that we continue to get that message out to our young. But again, as I talked with you before, I believe that when we're looking at the rate of HIV infection within just our city and in our communities, basically we're looking at going back to the basics.
Okay.
I believe that the basics starts with teaching in the home, providing education not only to students or basically students, but also start providing education around prevention with their
Exactly.
parents
Exactly.
or their caregivers.
Exactly.
And so that the message is not only given at one level, but it's given at another level. And then with our faith-based institution, there's the other level that comes in there.
Absolutely.
And so there we have a well-rounded type of education on prevention
Exactly.
around these diseases. So
You brought up a key point about faith-based. I want to come back to that. Before I go there, I want to talk about when AIDS first hit. There was just all kind of myths out there. I mean, it was just crazy. So first I want you to respond to the myth that you heard, and I also want Aman to respond to some of the myth that she heard, and then let's talk about the realistic aspect of that and what's real and what's not.
okay, I'll just one out this guy. I could get HIV by kissing
Right,
a person.
right. I heard that one.
Or if a person spits on you that has HIV, I'll get
Right.
it. Myth.
Right,
You know, basically you have to understand how HIV is contracted, and it's basically simple blood-to-blood contact. And so you can't spit on someone that has someone with HIV spit on you and you get it.
right, right.
That's a total myth. Kissing
Okay.
is a myth.
Right.
Again, you have to have the blood-to-blood type of contact
Right.
in that manner.
Okay.
So if you're kissing a person, for example, that has HIV, and that person has a lesion maybe open in their
Right.
mouth, and you, the non-HIV person, has one in their mouth, and so therefore you may have that blood-to-blood contact
Okay.
there. So
Okay.
the possibility of getting infected is there.
Okay. Okay.
Not saying that
Right.
it
go
will
ahead.
be,
Okay.
but
So, Aman, what are some of the myths that you heard, particularly among the younger generation?
Well, when the epidemic first hit, I don't believe I was born. So, so now that I passed that, but what I learned, or what I even thought, and was corrected on, was that if you transition from HIV to AIDS, that there's no going back, and that's a death sentence. When in reality, if you're in proper care and your immune system is not totally deficient, then you can come back from AIDS back to HIV if you have the proper care from a physician with the proper medications to bring that viral load down and bring that CD4 count back up. So I didn't know that before.
All right. I want to talk a little bit about the faith-based piece, and I want Mitch to kick that off, and then I want you, Ms. Miller, and Aman to talk about your experience with the faith-based communities, particularly faith leaders, whether they're pastors, assistant pastors, or whatever. But Mitch, when we look at the faith-based communities, when we look at our churches, and our level where we are dealing with pastors and senior pastors and missionaries and prayer warriors, I know we're concerned about a lot of things in the church, but on a scale of 1 to 10, where do you think HIV fit in our faith community? And with 10 being the highest.
I would say right now, from where I'm seeing it, HIV would be number one when we get past the poverty. And I say that because simply in most black churches, it's basically women and children.
Okay.
Men come and go, but it's basically
The women
and
children
the
kind of
children.
stay. Right.
So I think the care and the prevention have to start, like Ms. Miller said, in the home. But in our community, it's single family homes, just the mom and the child. And sometimes that's a challenge. And even in North Lawndale, sometimes it's the grandparent. So like she was mentioning, I think for faith-based organizations, we need to educate our congregation.
Right.
There are, for instance, at our church at Great Open Door, Mrs. Deborah Wilson, she's the minister there at the church, and they hold workshops. And she's a big part of that. And I think that more churches need to hold the workshops and get the mothers aware and educate their children and let them educate, because I think that's the only way the message is going to get out there.
Right.
It's no secret in the black church. You look up in children growing up from, it's just a fact that girls get pregnant.
Right.
And so, I mean, sex is no secret in the
Right.
church. They may not want to talk about it openly, but at this point with the congregation, it needs to be addressed. And a lot of faith-based institutions have stepped up. But like always, I think we can do more. The problem I find, though, is sometimes some preachers or pastors, they want to preach the homophobic idea, sin in God, and that keeps a lot of family members out in a way because they don't want to face the condemnation.
Right.
But I think with the way the world is, we have to respect the gender and deal with the problem.
Exactly.
Because the long-term solution is we want recovery and results.
Exactly.
And that comes out of a community like ours.
Exactly. You know, what I notice too in churches, and as I get around to them, whenever there's opportunity and whenever there is communication, whenever there is attention given to something, then the interest goes up.
Absolutely.
Typically,
Absolutely.
I'm going to start with tithing. When you talk about tithing and you have people come up and make a statement about it or a testimony about it and talk about how tithing has blessed their life, tithing go up.
Okay.
When people talk, when you lift it up, if the pastor allows so much time before the sermon. So, and then when politicians come into church, they allow politicians to come up. They can get 5 or 10 minutes before the sermon,
Right.
and then people raise their awareness about voter registration, who
Absolutely.
they should vote for.
Right.
I think we should do the same thing
I
for
think-
diseases that
Absolutely.
are affecting people in the church.
Absolutely.
Give it attention, communicate, talk about it to raise people awareness.
Absolutely.
So they can do something about it, and we don't do enough of that.
Absolutely.
We need to do
I
a
would
lot more
agree.
than that. Yeah.
I would
Now, both, let's go
definitely
back to the lady, Ms. Miller and Iman. Talk about what experiences you've had with the faith base in terms of the program that you have.
Well, in the Lawndale community, we are with Lawndale Christian Health Center. We do partner with other community
Right.
a faith-based institution, and so what we have going on, basically in our HIV or our programs clinic-wide, that
Right.
is part
Right.
of what the faith-based institutions that we partner with.
Exactly.
But when you look at other maybe faith-based institutions, you basically want them to model the same type of program, which is what we do within this particular industry. We know, and along with the government, with the Department of Health and Human Services, with CDC, with SAMHSA, it is known that the faith-based institutions are important in order to make sure that the education is out there in those communities.
Exactly.
And this is why they have convened a specific faith-based initiative,
Right.
so that that can begin to prosper within our communities, and,
Right.
and hoping that those faith-based institution comes along. On a personal note, within the church that I belong to, and I can't say with Trinity United Church of Christ,
Yes.
on the south side of Chicago, our
Dr. Terry
pastor,
Mason is there. doing
right?
stuff,
Yeah, yes, he is.
Right.
We do promote
Right.
testing.
Exactly.
Even our pastor has gotten up in the pulpit and was tested.
Okay.
We have testing in particular months, maybe in the HIV awareness month, on doing testing and education within the church after the services that we have.
Right.
So it is just in my opinion that more faith-based institution should
Exactly.
get on board, because this will not only protect their flock, but keep them healthy.
Exactly. Exactly.
And so
Exactly.
that's a no-brainer.
Right. And to your point, I had the privilege of sitting in the audience at the Lawndale Community Church. And Coach take his sabbatical during the summer. He allows some of his assistant pastors to come up and speak or preach.
Yes,
And Jerry Bolden,
absolutely.
one Sunday, had the whole service. And he preached about HIV/AIDS.
Yeah.
And he brought in other experts, and they showed slides. I really enjoyed that, and people really got lifted up and got really, intimate information about HIV/AIDS. And he shared a lot of stats and people came away with good information and felt good about that. So there are some churches doing some things about that.
And we
Yeah.
got a lot of tests out of that.
Right,
too.
right. Tell Jerry I gave him a little,
Okay.
a little holler out.
I sure will.
You know, Bishop, what I like about that is when you bring awareness to that, you also need to provoke them to start asking questions to their partners.
Right, exactly.
You know, we talked about that. Are you HIV positive or negative?
Right.
You know, because whether you're a senior or a teen, you need to know.
Right.
Because if you don't, I've heard a lot of those that have become positive say, I wish I had asked a question.
Yes.
So getting the church involved, getting the members involved, and get them educated and learn. Ask the question. Don't be afraid, because that determines your, like Mrs. Miller said, your health.
Exactly.
Your health and welfare.
Right.
So
Absolutely.
that I think that's a must.
No question about it. Iman, give us a little insight about your experience with the faith community.
Oh, okay. Well, being I feel like I have a more critical eye towards the church in general, and I feel like with faith-based organizations, I don't feel like they are doing enough in terms of prevention and awareness within their communities. I know that my church has things, but I don't really see them manifest. I hear them talked about, but I don't see them manifested. And to be placed in a community that does have a high HIV rate, I feel like we should be doing more. And I feel like it starts from the top and it trickles down. Therefore, clergy needs to adjust their attitudes and their messages, because a lot of times there's this homophobic message that is given out, and they are turning away the people who need them the most, especially people my age who are right now, I'll give it away, I'm 26. So people my age they're in need, maybe be in need of being in care of a church, and they may be homosexual or gay, same gender loving, or whatever term that they want to use, and they don't feel welcome. So it's an untapped market, and they don't have, and they may want to go to church, but the preacher is talking about you're going to hell, you're doing this, you're doing that, because you prefer to have relations with the same sex, when everyone else in the church is doing other things that are against the Bible. But he doesn't talk about that. So as a critical eye, I think that the church is turning away the people that they need to be tapping into, and yes, that's my answer.
You know, let me piggyback off there. What she said, that's the challenge in the faith-based community. That's what I mentioned earlier about preachers want to get up and they want to talk about the homosexuality and the sin of it all. But again, like the president of this country, his personal opinion is his personal opinion when it regards to sexuality of any individual.
Exactly.
But publicly, the gender of any person, gay, bi, straight, has to be respected. So we have to, may not agree with their sexual preference, but we have to still approach them.
Right.
Because sometimes healing has to be indirect.
Right.
You can't always bash them over the head and let them get it. Right. So I see that as a challenge with the different ministries around the community, but I also see ministers taking a different approach to that, because her generation, 26, their whole mindset is different than my generation in terms of church and service and God. But the whole man is physical, spiritual, and mental. And if you're going to nurture the whole man, the physical part, you need to get into the spiritual and the mental. So the church is going to have to learn to do that.
Right.
Because whether they believe it or not, we're going to lose a lot of our members based on the dogma attitude that some of us have.
Yes.
And I'm not saying, we're going to preach what we're going to preach. But what I'm talking about when it comes to preserving life, preserving the congregation, and preserving the families, we're going to have to find a way to get around that, because all of us need help and nurturing.
Oh, no question.
And so I would agree that we've got to find creative ways to get in, because there are some individuals who have a sexual preference, but they're just curious.
Exactly.
Sometimes when you really help them after you stop bashing them over the head, and sometimes you help them find out where they really are, then they make lifestyle changes. But that's not my calling. My calling is to make sure that they're wholesome, physical, spiritual, and mental. Whichever way we have to do that,
The whole person.
that's what we have to
Yeah,
do.
yeah. And so to your point, you know, when you lift it up, when you talk about it, when you create programs and activities, and it may not always have to come from the pulpit.
That's true.
You got to create training institutes,
That's true.
do workshops, do seminars in the church, in and around the church. And as you know, we've talked about that for our collaborative, is the more information you provide in terms of workshops and seminars, breakout session, that stick with people.
Absolutely.
And then follow up with it, just like you and I do the anti-violence conference every 6 months. And then, of course, when you talk about anti-violence, you talk about poverty, all the AIDS runs through that whole process. You know, people out there doing that kind of stuff. So we got to take the bull by the horn and make an impact and make the difference by being better leaders, making more better informed decisions, and engaging our people with the right things.
Yeah, and
Miller. Ms. Miller?
just like to inject there, and also with a non-judgmental
Right.
perspective,
Right.
which is very important, especially among our youth.
Exactly.
And those living with HIV.
Absolutely. Absolutely.
Living with HIV.
Absolutely. Now, when AIDS first jumped out, you heard drug users sharing needles. That's all we heard. And then we
gay
heard the
lifestyle.
myth, of course.
Right.
All the myth were out there. I even heard sitting on the toilet in the bathroom that there was a way you could contact it.
Right.
But Iman, you would know, Ms. Miller, you would know, intravenous needles and heterosexual intercourse. Which of the two now is the most prevalent that AIDS will come from or get contacted from?
Well, in my opinion, I think it would be heterosexual contact because of, I know in Illinois there is a huge needle exchange program that goes on,
Right.
especially like Chicago Recovery Alliance. They do a huge needle exchange, which is very known throughout the city, which reduces those used needles that are on the streets. So I would say heterosexual contact just for the mere fact that women are more so monogamous when it comes to relationships and men are more promiscuous. So they have these women who are at home thinking that, oh, my man is maybe just at work or whatever, but he's out doing whatever, and then he comes back and gives it to her. And so that's how it's introduced into the heterosexual realm.
Population. And I totally agree with that. ID users are, as far as contracting HIV, specifically in putting those harm reduction strategies in place, has done wonders in reducing HIV infection among that particular population. Just basically currently right now, the worry is about hepatitis. And so
Okay. Right.
and so we're looking at that, and that's
Right.
escalating in that area. But
Okay.
yeah.
I recently read, I was reading last night, I've doing research, and I was reading on a website called eMedicine Health, and they talked about HIV declining in children. And they said the reason it's declining in children because the testing of the mothers coming to the clinics. And here we go back to the women again. And I want to hear about your experiences, Ms. Miller, and also Iman, in terms of the women being tested when coming to the centers and the declining rate in children.
We have a maternal child and health program, which basically we bring in those that could walk in and get a HIV, a pregnancy test along with an HIV test.
Right.
And those that we have, and I have experience where sometimes that those particular individuals may be test positive on both ends. And so what do we do about that? What we do, our referral system is great. Lawndale particularly does not handle pregnant women, but we do refer out to the University of Chicago and also to Mount Sinai Hospital, who has an excellent program for prenatal care for women living with HIV. And so the protocol is, the clinical protocol or guidelines is to make sure that those women who are HIV positive are on antiretroviral therapy as soon as possible in order to protect that fetus from the HIV virus.
Okay.
And so that's one of the strategies that they do. On other ends, there may be a little change, but the rate of newborns being infected with HIV has lowered considerably due to antiretroviral therapy. So.
Iman?
I totally agree with everything she just said. And also, a previous experience, I've learned that women, as opposed to men, are just offered HIV tests more frequently than men. So that chance of knowing that you're infected is higher than it is in men. And if they're pregnant, then it's also almost
It's
mandatory
automatic.
that they have
It is automatic, yeah.
that they get that test. So.
Is that because men don't go into the clinic and try to get?
From research that I've done, it's that men aren't as proactive about their health, as opposed to women who are normally like the head of the households now, and they have to take care of everyone, including themselves. And men just they're more reactive. Something hurts, so let me go to the doctor, as opposed to let me be proactive about my health. And that's just men in general.
Well, that's true. We have to agree. That's pretty much where it goes.
We all know that HIV is an immune deficiency syndrome. And talk about how that ties into lifestyle. A lifestyle. What's the contrast between lifestyle and deficiency and immune deficiency? Is there a contrast there that can be beneficial when you look at lifestyle? Ms. Miller?
I guess I would have to say it depends in the area.
Okay.
Basically, as we know now, that people infected with HIV is living longer and much healthier lives. And so when
Magic
you talk,
Johnson, I like
right?
Magic Johnson.
So when you're looking at lifestyles, like with any other chronic disease such as diabetes or high blood pressure, HIV is considered a chronic disease now. It can be maintained. It can be managed.
Okay.
So your lifestyle with people living with HIV, they can live healthier lives and live longer. In other words, the mill said, I know who is HIV positive by the way that they look. That is no longer the case.
Right.
So,
Okay. Come on.
She said everything. She said everything. So I really defer to her.
Mitch and I was talking earlier coming over, as we always have our long conversation. And Mitch, I want you to share about the strain of the 1% of people who have this mechanism that wards off HIV, and then the guy who got the transfusion and who cured the AIDS piece. Talk a little bit about that.
That was interesting. I tried to find out. There was a case
Right.
of a young man who was known to be HIV positive.
Right.
And I didn't know. I tried to find out the name before we got here, but there's a 1% ratio in the Caucasian race where they don't get the infection. So with the young man, he happened to come across one of the donors, and he was able to use his. This may not be the proper word, gene, but he was able to implant that. I'm gonna say DNA or gene into his marrow, and so with that, he after it was all said and done, he was cured of HIV. He went from positive to negative, and I never knew, and I'm still researching that out. But I was amazed to find that there was 1% out there that the HIV gene just couldn't break down the cell of this particular 1%. I'm trying to find out who that 1% is, and it was said that it's been recent. But I was amazed to that fact because I thought that if anyone caught the HIV virus, that like you said, it's a chronic disease that they have to live with for a lifetime. But they say it's that 1% out there. It's a blessing for them to be that 1%, but that's far in between, don't you think? You know?
well, my comment on that is that 1% that you're talking about. Basically, it's something that it is that we all hear of these miracles that happen in other cases. Again, it's not enough evidence to say that that is the case
Right.
of
Okay.
curing HIV. Number one, because we don't want to come out and give this type of information out and disillusion people that if I have a replace my I know the word that you're
Bone
talking
marrow.
about.
I can't.
Yeah,
Bone marrow, yeah.
bone marrow, that I'll be cured
Right.
of HIV. First, that's a costly method, number one. And so when you're poor, and
Right, absolutely.
again, that may not be the reality.
Right.
But we have to get back to the basics
Absolutely.
on things,
Right.
and making sure
Right.
that we are providing the education, providing the message about preventing one from getting infected with HIV. So.
Well, this is what I said after we talked about. I said, if there was such a person, he would be dissected. He or she would be dissected so fast, put into a laboratory, cut up in pieces, and sent across, the world because
Right.
everybody would want the cure.
Absolutely.
You
Use
know.
that research. You find out
Absolutely.
what, that's what it's all about.
But like you said, it starts with education.
Absolutely.
And that's how we do the
Absolutely.
prevention.
Absolutely.
You know.
We got about 10 more minutes left, so I want to use that 10 minutes to talk about programs and support and healthcare systems that are in place that will continue to help people with age in terms of education and treatment. Ms. Miller, let's start with you. Is there something other that's sustaining that is going to be long term to help with that?
Again, with your primary care providers, making sure that testing is readily available, access to care, linkage to care is available within the communities that are underserved and poverty stricken.
Okay. Come on.
To piggyback off of that, I would say not only the access and linkage, but also those other aspects that affect low SES individuals. So the housing, the job referrals, the education opportunities, and different skill building things that would necessarily build up the whole person and not just focus on the disease.
Right. So I know you work as in a collaborative partnership with the City of Chicago, and that's just one component of what you do, because you do a lot of things as you're in Chicago. But you guys get some funding from the city to orchestrate the program that you're part of.
Yes, so the project that we're a part of is in collaboration with Chicago Department of Public Health and working with their disease intervention services workers
Right.
to enroll individuals who are high risk into an intervention that for pre-exposure prophylaxis. So to introduce them to the pill and give them an option to take it and see what their attitudes are towards it at the beginning, in the middle, and at the end. So, and I believe that that PrEP is actually very good going forward to see how it works out. In my opinion, it's kind of just like birth control, but for HIV.
Okay.
So
Right.
if we can change those negative attitudes that are forcing against that issue, I think it'll probably help in the long run.
Okay. Mitch and I just attended an initiative called Tech Thursday. And inherent in Tech Thursday was a piece on cloud funding. And we attached ourselves to a whole bunch of resources and networking within that organization. And within our collaboration, Mitch and I have resolved that we're going to tap into that to educate ourselves and also share with other faith communities. So Mitch, talk a little bit about Tech Thursday and what you got from that and the cloud funding piece.
Well, the same, like the social media is the mainstream where you get a lot of support, information, and basically that's the way of the world right now. I like what she said earlier when we were talking about reaching out to get supporters to support the information that they're doing. It seems to be negative now.
Right.
But between the workshops and getting different organizations to see we need this funding to be able to market in a better way or to inform or do the workshops, cloud funding is a way of doing that because even though dollars are great, opportunities only come when people hear about them.
Right.
So crowdfunding is a good way to do that, along with the partnerships that we do with other organizations. And certainly what she's doing, I said we would love to keep doing what, informing residents, faith-based institutions of how their congregation can benefit from her services. Now, Miss Miller and I had talked about there are pros and cons. I like the fact that we don't want people to be ignorant and think that
Right.
you can take the prophylactic pill and you don't have to worry about you'll never catch HIV/AIDS. That's not the case.
Exactly.
We're talking about prevention. If you're HIV negative, we want you to stay HIV negative.
Okay.
So crowdfunding, helping us get a market out there to get that kind of information out is the best way to do this now, because grants are out there, but sometimes the bleeding heart is the quicker response to get the
Right.
results we want to get.
Right.
And what better way to do that than through
Right.
crowdfunding?
Okay. We got about about a minute from each one of you, a minute from myself. Ms. Miller, I want to have you talk about what you feel that you're contributing to the field and how you're going to continue to move forward to make an impact in a positive way in the community with what your programs are.
Well, my
Same thing
first,
for everybody else.
okay, my first view, and especially working in the field of HIV, I never knew that this is where my career would
Okay.
bring me to.
All right.
And so when you're being called to do something, it comes directly from the heart.
Right.
And so my job, and I feel as far as how the Lord leads me, is to make sure that programming is there for people living with HIV,
Okay.
and also that those supportive services are there, and just the overall general support for HIV in their supportive services and their primary
Thank you.
care.
Mitch, real quick, we got 2 minutes.
Same. I'm like her. The support. I can't sit by and watch people suffer neatly off of ignorance.
Right.
I feel that education is the best way to go, and I feel like I will exhaust myself and every tool I have to make sure that people get educated on this.
Right.
Prevention is what we need, and I want to do that. I want to try to prevent
Okay.
the risk.
Okay. Iman?
Basically everything everyone else said, and also I just feel like as a youth that I want to be like that radical voice that
Right,
is
absolutely.
there for the people that I'm fighting for.
Thank you.
Absolutely.
Well, I want to thank each of my guests. Ms. Miller
Thank you.
from the Lawndale community and the AIDS program, Oman from the University of Chicago and our AIDS prevention program, and of course my sidekick, Minister Mitch
Thank you, Bishop.
Shula,
Thank you.
who we're involved in many things, but one of the things that is uppermost in our hearts is to connect with
Yeah.
people, to collaborate with people, form partnerships, and do what it takes to make a difference in people's lives
Absolutely.
that can impact them in positive ways.
Absolutely.
And as we do that, we want to make sure that we push them, we allow them to dig deeper, that they can go on to reach their full potential in life. So again, thank all of you as my guests, and we will like to invite you back one day
you.
soon.
Thank you.
All right.
Thank you
Thank
for
you so
having
much.
me.
Thank you.
Very-
Been a great show.